Today we are doing a Sculptra injection procedure. And Sculptra is made out of Poly-L lactic acid, and it will make you make collagen, which is always what we want. How to make collagen? This is how you do it, with some Sculptra. So it's an injectable. It takes about 3 months to see the final results, and it's usually done within about 3 sessions. So you come in 3 months in a row, and your final results are 3 months after the 3 months, so about 6 months later. But what happens is it's a very natural look, and it just kind of gently pulls your entire face back. Not a facelift, but a very natural lifting and tightening that happens with Sculptra. And Sculptra patients are happy with the results for over 25 months. So it's very long lasting. All right, are you all set? So I'm going to show you guys a typical, you're really cold now, a typical Sculptra procedure. So I'm going to start in the temple. Ready? 1, 2, 3. La la la. Good job. And we're going to go all the way down. Good job. So we're going to inject a little in the temple. Excellent. And that's a place people will see aging. And I'm going to go down the cheek. 1, 2, 3. And inject it deep, deep. Even a little deeper. Good, good. Excellent. And I want you to put a little ice right here for me. We're going to go right in front of the ear too. Again, everything to be kind of the periphery of the face to pull everything back. Perfect. 1, 2, 3. Ooh, la 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 la. All right. And there we go. And then I'm going to pull some more up. So we're going to pause for just a second, and then we'll continue on this side of the face. So we're going to continue on. We're going to go right next to the nose. 1, 2, 3. La la la. Just a little right there. It helps really just lift that upper lip up. We're going to do some down here. 1, 2, 3. You okay here? Mm-hmm. Perfect. Just a little there. Just a little or a lot, still a poke, right? Mm-hmm. Put some ice right here for me. And this is a great, I'll show you on this side, this is a great area to use Sculptra because there's no filler that's going to fill in this spot. So we just need to lay a sheet of collagen producing something there, which is what Sculptra does, in order to get tightening of those lines that can happen. And so we're going to do a little bit, just as a little 1, 2, 3. Yay, yay. There we go. Just to lay a little foundation of scaffolding to make some collagen there. All right, we're going to do the other side now. Ready? 1, 2, 3. Ooh, la, 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 la. There you are. Good girl. Awesome. I'm going to go down the cheek too. Okay, ready? 1, 2, 3. Oh, feels good. I love it so much. Here we go. And then, okay, good. Now what I want you to do is hold it right here. Here we go again. 1, 2, 3. Here you are. Perfect, perfect. Ice right over here now. Excellent. And then we're going to do that nose and the chin on this side. So potential issues with Sculptra is obviously bruising. You can, because we're using a needle. Sometimes in the past, people have gotten little like granulomas or little balls underneath the skin. And that was usually because the mixing protocol was different. And now we have a different dilution. And so that usually doesn't happen. But of course, you definitely want to go to a seasoned injector because if you inject this stuff too superficially, that could also happen. But and like I said before, it's just a really natural look and gradually lifts everything up. 1, 2, 3. You're doing so good. Just a little bit right there. And then let's do, did you ice this a little bit? Ice that for a second. And when you want people to not know what you've done, but to know that you look good, Sculptra is a great treatment for that. And it helps with the skin and the skin texture too. So it's not just the lifting that it does, which is great, but it does help with the skin itself. Okay. 1, 2, 3. Here we go. Right there. Okay. And one more ice over here, and then we'll be all done. Aftercare for this is for the next 5 days. I will want you to massage it for 5 minutes, 5 times a day for 5 days. So 5, 5, and 5. That just helps push those particles closer to the fibroblasts that are going to make you make collagen. And collagen starts being made as early as 28 days, but can take as long as 3 months. So you have to be patient with this one. But I know a bunch of patients, I have a bunch of patients that this is what they do. Instead of filler, because sometimes people eat up filler too quickly, they do Sculptra instead, which is a great alternative. And I do Sculptra too. I love Sculptra. Okay, last one. 1, 2, 3. You just kind of and just a little scaffolding everywhere for this part. Perfect. And you're all done. So we'll do some massage, but besides that, you have now witnessed a full Sculptra treatment. And usually people do as many vials as they are decades old. So typically when you're starting with Sculptra, it's usually 1 vial per decade. And then 1 vial every year will keep my face looking great. If you were 40, you'd start with 4 vials, 50, sometimes people start with 5 vials, 60, higher. But you could always start with 4 and then in 6 months or a year, then do maybe instead of doing just 1 vial, do the 2 vials. So that way you're already caught up, you're 66 vials in a year. But it's a great treatment, it's very natural looking. She'll be puffy for a day or 2 and then that will go down and then she'll be like, oh, where are my results? And then in about a month, she'll start looking at herself in the mirror and going, I'm seeing them. And then she'll come back in, she'll do another vial, and then she'll see her results more. And then after the 3rd vial, 1 month later, she'll love it even more. So it's great, easy treatment in office. It took us, 10 minutes? And if you want to find out more about it, you can find us online at RejuvenationMD, medspa.com.